Plantar fasciitis. One of the most common reasons someone will come to my practice for a lower extremity issue. The issue that I have found in practice is that my treatments don't necessarily work on everybody. However, our evaluations do. And one quote that has always stuck out to me, and I included in the blog, was a quote from Snook in 1972. And it said that if you look at one condition, and there are multiple theories of etiology and multiple treatments that may work for that condition, there's a really good chance that there's really not any one proof of any one cause. And that has never been more true in the foot. And the problem with the foot is you take a mobile adapter that has to be nice and flexible to adapt to the ground beneath us, and you have to turn it into a very rigid structure and lever to propel yourself forward. So it's got a tough job, and it fails a lot. However, the part that fails, the plantar fascia, is not necessarily the problem. In fact, we have to look above and below stream to find out what is causing this problem and what can we do as evidence-based providers to help our patients get out of pain quickly. Hi, this is Brandon Steele with Chiro, and I'm going to go over 4 of the findings from my blog from this week that I'm going to take a little bit of a deeper dive into. Number 1, as I just covered it, is it's not the tissue that failed. It's not an inflammatory condition. It's not something that just happened with increased activity. Most pain coming from the bottom of the foot is actually degenerative and not inflammatory. We have to treat it as such. I don't care if you use your hands as far as cross-friction massage, if you have some patented technique, if you use some kind of instrument, if you use extracorporeal shockwave or laser, find something to help promote an acute inflammatory reaction that is local to that area to help that person heal. The next part I want to cover actually combines number 2 and number 4 in the findings from the blog. That is that it's not just the plantar fascia. There's multiple structures at play. And when you have any restriction of any joint, especially in the 3-rocker system we see in the ankle, that something will pay the price. And the weakest link, in this case, is the plantar fascia. There's one thing that we find consistent across people with chronic plantar fasciosis, and that is limited ankle dorsiflexion. I'm not going to comment on whether that's an etiology or just a repercussion. We're not quite sure. However, one thing that we do know is that when you can regain ankle dorsiflexion, we can help our patients recover faster. I included a link to a blog that I think was from 2020 on a simple exercise that your patients can perform in office starting today to help them in their recovery. The next part is manipulation for ankle dorsiflexion, for the ankle mortise joint, for the midfoot. I don't care what you do. I don't care how you do it, whether you use a speeder board, whether you use your hands, whether you take classes for seminars, an MPI class would be wonderful for this. Learn how to manipulate the extremities. It will pay dividends for you and for your patients. Finding number 3 is that you put a crazy amount of force through your foot. 7 times your body weight goes through the plantar fascia when you're running, when you're propelling forward. That's a lot of force. It's not necessarily the activity. Your body is designed to absorb that kind of ground reactive force. But we have to also give it time to heal. So one of the biggest factors in plantar fasciitis, or plantar fasciosis in this case, is not necessarily the activity. It's giving our patients adequate time to heal. We can help that with education, and we can help that with stretching and just a little bit of a pat on the back that everything's going to be okay. You're going to do these exercises, but it's going to take a little bit of time for your body to heal. And patients will understand that if they share your same goals. The last part is finding number 8. And this is probably my favorite finding, is that when you have pain, in the absence of red flags, in the absence of trauma, there is very little to 0 correlation with structure and function. So don't hang your hat on one specific orthopedic test, one specific evaluation, a functional evaluation, a clinical prediction rule. Is that we really need to treat every patient as a case study of one. Understand what they're doing, when they started doing it, And are they giving themselves enough rest? And if you can eliminate enough variables that led to that person's overload of that tissue, and you can loosen it up with manipulation and mobilization, and you can keep it loose with some at-home rehabilitation exercises, and they can give themselves enough time to heal, you have a winning recipe. Next time you have a patient with plantar fasciitis, print off the condition report from Chiro Up. Give them every piece of the puzzle to help them solve their own problem. We're there to help. We're there to give them the encouragement and the education and the exercises and the mobility to help get them on the healing process. Thanks for watching this vlog. If you have any questions, my email is brandon@chiroup.com. I'd be happy to answer any clinical questions or at least moving you and your patients in a path of recovery. Thanks for watching.